Let's say you've got 6 months to a year until Medicare kicks in, and you're looking at the prices of health insurance. You're like, oh goodness, I got to figure something out. Let's go into that. Let's look at what our strategies can be if we're trying to insure until Medicare starts. But we're going to tell you a secret for people in their late 60s or mid 60s coming up to Medicare that could save you a ton of money. Let's get right into it. Usually this question revolves around a Cobra option. Let's say you're coming off employer coverage and the exchange. Cover California, for example, in California. How do we compare this? We have a whole article that goes into that. But let's touch base on the key points and why for people who are 63, 64, 65 coming up on Medicare, it really is in their advantage to look at Cover California. And here's why. The big part of Cover California is the subsidy. And that's how much the federal government essentially through Cover California is going to pay towards your health plan. And that subsidy is based on costs. It's essentially it wants to cap your share of healthcare costs to a certain percentage. As we all know, as we get older, it gets really expensive for health insurance. So that subsidy also shoots up. When we're looking at a certain area for a given plan and a given income, say 40K, a 25-year-old will get a little bit of subsidy, but a 64, 63-year-old will get a huge subsidy. In fact, it'll actually bring the cost down lower than what a young person is. It's kind of interesting to look at. So we've got to dial in the income piece to make sure we're getting that full subsidy. And that's where a lot of people coming up on Medicare, they have a year to insure maybe, they make mistakes and they don't get the full benefit there. We're trying to estimate this year's income, the income that we're looking to get insurance for. And it's the AGI or the adjusted gross income on our 1040 tax form that we're trying to estimate. Reach out to us if this is complicated. We do this all day long. We can roll through it. But usually for someone who's 63, 64 years old, that subsidy goes through the roof, depending on our income, even up to pretty high incomes, especially in certain areas. So we really got to fine tune that to make sure we're getting that full benefit. Also, the plan option or choice of plan is really important. Let's dive into that piece now. Here's the secret we're going to tell you. Starting in 2025, the Silver 73 is super rich regardless of income. It's essentially a gold level plan. There's no reason to go higher than the silver. So the gold and platinum, it doesn't make sense when you're in your 60s to pay the extra premium. You're going to pay maybe $5,000, $6,000 and your max out of pocket is about the same. So there's no reason to go up the scale between the silver, gold, or platinum. So it then becomes a silver, and here's the part most people don't understand. You got to look at that bronze plan. That's the secret. And there's two bronze plans. The one we're most interested in is the HDHP. That just means it's HSA qualified. You don't have to open an HSA plan, but you can if you want. The HDHP plan is really nice. It's a clean design. The deductible is the max out of pocket, meaning you pay up to a certain amount for in-network covered benefits, then they take over. That's it, nice and clean. Here's the key point for someone who might be 63, 64 years old. The premium difference between the bronze that we're looking at and that silver 73 can be thousands of dollars. Well, then it's really hard to justify going up. Even though it may be kind of new to you to have a high deductible plan, if you're going to pay $3,000, $4,000, $5,000 plus to go up to the silver, it makes no sense because the max out of pocket, meaning when does a plan take over for really big bills, is virtually identical between the bronze HDHP and that silver 73. There's no way you ever come out ahead by going up. Now, everyone's situation is different, so reach out to us. We're happy to walk through the savings for you between the bronze and silver, but we really recommend looking at that HDHP plan versus the silver. Networks are identical. So if you're looking at a Shield PPO plan, that's going to be the same whether it's the HDHP or the Silver 73 within Shield's PPO network or choices. So then we're looking at premium savings over a year's time versus benefit difference. And we're happy to go through that with you. We just need dates of birth, zip code, and best estimate for this year's income. Also, another mistake a lot of people make is a spouse is already on Medicare, so they just put their information in. The definition of household at Cover California is everyone that files together on a 1040 tax form. So if you file jointly with a spouse who has Medicare, we still want to include them in the quote, but not enrolling. So, and we can do this for you. So reach out to us, but we want to make sure everyone on that 1040 is part of the household because it'll make your subsidy go up for the actual person who is enrolling. So that's the Cover California piece. Look at that bronze versus that silver 73. No reason to go higher. Then it's a question of networks, what doctors you have access to, and we can chase that down for you. Let's look at two other options that people usually are contemplating when they're waiting for Medicare to kick in. You do have a Cobra option. You're 63, you don't have Medicare yet, or 64, either way, and you're looking at it. How do we compare that with Cover California, the plan before? Cobra generally is very expensive because it's your total cost without the amount that the company was contributing or subsidizing for you. So it can be a big number. So if we're going to get a subsidy in Cover California, that makes that decision pretty easy. The only caveat is this: the networks are different between employer plans and individual family plans, including Cover California. The group plans tend to be bigger. Now, if you're with Kaiser, it kind of doesn't matter. Kaiser's Kaiser. But let's say you want to go to Stanford. Well, Stanford right now isn't working with any individual family plan. So making that transition won't work if you have Cobra. But then you got to compare, all right, Cobra's, $1,000 more per month. That's $12,000 a year. And I went Stanford, but I only have 6 months to go until my Medicare kicks in which case I could get a supplement and go back to Stanford. So there are a lot of moving pieces here. Just keep in mind those networks can be smaller. Let us chase that down for you when we run the quotes. And we'll see if we can find a plan on the individual family network that works with your doctors and hospitals. Otherwise, then it's a situation of price because most of the group plans are ACA compliant, meaning they cover a lot of the same things as the individual family plans. It's really the doctors and hospitals we got to double check, and you got to take into account that premium difference. A lot of people are like, I only have 6 months till Medicare kicks in. I want to save the money, and we can look at ways to do that for you.